the soldiers, et cetera.
I think you just said it.
Yeah.
End-to-end experience. If I look at what the future is going to hold for us as we build out kind of a new technology platform, the technology piece is going to be transparent and should be very quiet to the end user. The end user experience, the care that our soldiers, sailor, airmen, and Marines receive should not be dependent on the technology. It should be that technology piece and that layer should be transparent. They should be getting the information that they need. Their providers need to have that, whether it's in the battlefield as a battlefield medic, or whether it's their provider or care in the air, or patient transport, whether it's care at the VA, whether it's care at a managed care support contractor, purchase care is what we call it. Regardless of where our military members are in the system of healthcare, they need to be able to get their information in the right place at the right time. So their providers can make the right decisions, and they can make those decisions with their providers. So having that available to them without all the alert fatigue, I see in the future the patients owning their data and being able to provide that to whomever they need, and really understanding that it is their data and their information that goes with them throughout their entire life and into the VA, and until they pass.
And I would imagine that there'll be a day where the service member can interact directly with the doctors, right? Through a telemedicine type of environment, using some of these mobile technologies, et cetera. You're seeing a lot more of that. Is that something that you would expect to see?
To open that up,
yeah.
we could talk about virtual health. I mean, we've been doing telemedicine for 28, 29 years, not new,
right,
but certainly underutilized, and I think a lot of the laws have changed in order to allow that cross-state, cross-border evaluation. But since we've been kind of tied down a little bit by some of those as well, because even though we're in a federal system, the virtual health still has laws that go along with that in the federal space. So.